Hello, now we're going to continue with breathing pathologic signs. For the breathing pathologic signs, you need to know, so this is, let's say that this is your x-ray. Is it clear? Now on the x-ray, you're going to have the lungs, you have the lung field on both sides, you have the cardiac silhouette, and then you have this other lung field. So those are your lung fields. Now, for the breathing pathologies, you need to visualize well the lung fields, and inside the lung field, you can have different pathologic signs. We have already first discussed about the air bronchogram. We have discussed about the air bronchogram, and the air bronchogram is a line of opacity, means that inside is going to be dark. Inside is going to be dark, a line of opacity, a line of lucency, within a line of opacity. So you're going to see darkness like this as I've drawn, within opacity or whiteness. Is it clear? So when you see like that, it's an air bronchogram. Is it clear? And now, air bronchogram is specific for a bronchopneumonia. When you see an air bronchogram, it's specific for a bronchopneumonia. And bronchopneumonia is caused by atypical germs. Is it clear? It's caused by atypical germs. I'm not going to list again atypical germs here because we have already discussed about that when we were seeing the case of neonatal sepsis. I've discussed about all those germs. Is it clear? But I may tell you at the end. Now the next thing after that is specific for bronchopneumonia. The second element is lobar pneumonia. How do you visualize lobar pneumonia on an X-ray? Lobar pneumonia is going to be visualized with a consolidation syndrome. Consolidation syndrome. And consolidation syndrome has which element? The first element of consolidation syndrome. The first element of consolidation syndrome is that you're going to have a homogeneous you're going to have a localized homogeneous opacity. Is it clear? That is a consolidation sign, radiologic sign. Is it clear? So you're going to have a localized homogeneous opacity. After having a localized homogeneous opacity, which is going to be on one region, we have the second element of the consolidation syndrome, which is you can have also an air bronchogram. Basically, an air bronchogram. But you need to know that when you visualize the localized homogeneous opacity with air bronchogram, the pneumonia is lobar pneumonia. But when you only visualize an air bronchogram without visualizing any homogeneous or localized homogeneous or heterogeneous opacity, it can be homogeneous or heterogeneous opacity. If you don't visualize, if you see only an air bronchogram without visualizing a localized homogeneous or heterogeneous opacity, it means that it is not lobar pneumonia but bronchopneumonia caused by atypical germs. I hope you're understanding this pattern clearly. So those are the different elements that you can have when you have a consolidation syndrome. Generally, consolidation syndrome do not shift the mediastinum away from the affected side. Is it clear? So those are the different elements you have from consolidation syndrome. And every time you see these two elements showing consolidation syndrome, it tells you that the pneumonia is lobar, and lobar pneumonia is caused by typical germs. So let's list again the typical germs here. The typical germs are going to be as a result of one, Streptococcus pneumoniae. You're going to have Streptococcus pneumoniae. Second is Haemophilus influenzae. The third is Klebsiella pneumoniae. And the fourth is Staphylococcus aureus. And Staphylococcus aureus particularly cause pneumocells formation on the lungs. Which resembles like cavitations. Is it clear? So those are the different things that you have to understand. Now, those are after visualizing the lobar pneumonia with the typical germs, you need to know that we have also another pattern that can be presented on the X-ray. Is it clear? And that pattern is going to be a case of an interstitial pneumonia. Now with interstitial pneumonia, you're going to visualize reticular opacities, meaning that this, let's say that this is your X-ray, you are going to have the long field here, and you have another long field here, you have the cardiac seaway. So if you see lines which are bending like this all through, diffuse all through the long fields like this, these are more of reticular opacity. Is it clear? So when you have lines like this, you can have this are called reticular opacity. Is it clear? Now reticular opacity can be in straight line. Is it clear? That's linear reticular opacity. Or we have also nodular. They can also be nodular. Either the linear reticular opacity can be in straight line. That's called linear reticular opacity. Or it can be nodular. Is it clear? Now, when you have rectilinear reticular opacity, they are mostly in the case of interstitial pneumonia. And interstitial pneumonia is caused by atypical germs. It's caused by atypical germs. Now, we have atypical germs in interstitial pneumonia associated with immunocompromised patient. It can be atypical germs associated with immunocompromised or associated with known or immunocompetent. I'm going to tell you the microorganisms. And then we have others causing the micronodular reticular opacities, which is also said to be the miliary pattern. Now the miliary pattern shows you that it is a miliary TB. So those are the different things that you have to understand. Now let's go back to which atypical germs cause interstitial pneumonia. The atypical germs causing interstitial pneumonia are also associated with bronchopneumonia. Particularly the major atypical germ causing bronchopneumonia is going to be the Mycoplasma pneumoniae. Mycoplasma pneumoniae is a major atypical germ causing bronchopneumonia. So when you are seeing an air bronchogram without all those interstitial opacities, you think mostly of Mycoplasma pneumoniae. Now, other atypical germs which can be associated also with interstitial pneumonia or bronchopneumonia. After Mycoplasma pneumoniae, we have also Legionella pneumophilia. You have Legionella pneumophilia. Is it clear? The third one after Legionella pneumophilia, we are going to have Pseudomonas aeruginosa. After Pseudomonas aeruginosa, we have also we have seen Mycoplasma pneumoniae, Legionella pneumophilia, Pseudomonas aeruginosa. So those are examples. We have Chlamydia pneumophilia. Chlamydia pneumophilia. So those are examples of germs which can be associated, and particularly they occur in immunocompetent. Is it clear? Now, in addition to that, if you have a patient that is immunocompromised or immunosuppressed, you are going to have all these germs associated. And you have also another one which is pneumocystis jirovecii, particularly associated with HIV patients who are immunocompromised. Is it clear? So those are the different things. And now the last one, which is another reticular opacity, or it can also be considered interstitial pneumonia, is when you have a miliary pattern, and that miliary pattern is going to occur when you have miliary TB. Most of the time, the miliary TB, the Mycoplasma tuberculosis associated with the miliary TB pattern is mostly the Mycoplasma. Mycoplasma is the Mycobacterium tuberculosis.